Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. Today is a great episode that's really going to get you thinking, or maybe even scratching that itchy head of yours, because we're going to talk about itch, especially chronic itch, with a colleague of mine, Dr. Ruiz Dasilva. He's an Ivy League trained dermatologist practicing in Virginia Beach, Virginia. He was born in Brazil and raised in South Florida and attended medical school at the University of Pennsylvania, and then completed his internship and dermatology residency at the hospital at the University of Pennsylvania, where he actually ran a clinic dedicated to itch. There he developed an expertise in chronic itch, inflammatory skin diseases, psychodermatology and dysesthesia, skin of color, skin cancer, and aesthetics. So Dr. Ruiz Dasilva, I'd like to welcome you to the podcast today.
Thanks, Dr. Trotter. Thank you for having me. Treating itch is near and dear to my heart, so I'm really excited to be here with you.
Well, and I think it means a lot to people in general. You know, having itch, I think all of us has gone through something that's itchy, whether it's that classic mosquito bite in the summer, or we've had a rash that's been itching, or some people that itch maybe with not so much rash. So I wanted to give you an opportunity to really describe, some of the reasons that people might actually itch, kind of the wide variety and the spectrum of itch that we might see. And then we'll really hone in on kind of that chronic itch we're going to talk about today.
Yeah, absolutely. So there's so many different causes of itch, both acute itch and chronic itch. So acute itch is itch that lasts for less than 6 weeks, and then chronic over 6 weeks, kind of an arbitrary number that we've decided in the medical community. Of the more basic causes, I think that many folks are familiar with, of course, right? There are, bug bites, poison ivy, kind of external factors, always as we call them, getting some kind of caustic substance or irritating substance onto your skin, or something some skincare ingredient that you happen to be allergic to, that sort of thing, right? But then beyond that, there's lots of inflammatory disorders that are just things that happen to people, right? Like eczeama or atopic dermatitis, psoriasis, seborrheic dermatitis, which is kind of like a severe form of dandruff that folks can get. And many others that are considered inflammatory, not necessarily autoimmune. But then there are also autoimmune skin disorders like lupus and that sort of thing, dermatomyositis, that can cause itch. And then outside of that world, all these things I described usually come with rashes and that sort of thing, or a skin lesion that's popping up, a growth or a bump of some sort. But then there's also neuropathic itch, which is fascinating. We're learning a lot more about now in the medical literature, which is just essentially nerves misfiring, or those neurons, those nerves that are attaching to our skin, they send itch signals to our brain, and for no good reason typically. And the patients can suffer a lot and not have a lot on their skin. And so historically, sometimes these patients have been labeled as crazy, right? Or just, oh, you're just anxious, or it's in your head. But there are real biologic mechanisms that are making them itchy, and there are things that we can do to treat it. And to your point, I love what you said about we've all experienced kind of like that really itchy bug bite. That's kind of how I internalize it, when I talk to myself or telling colleagues, like, to take it seriously, even if they don't see much on the skin, because it's like, if you've ever been itchy, just imagine that feeling over a broader surface area and just like lasting for weeks or years on end, right? And it's enough that, historically people have been driven mad and even committed suicide due to itch that they couldn't improve.
Yeah, I think that's something people underscore. I like to talk with patients that we in dermatology take itch just as seriously as some people might take pain. And I think you're right, because itch can be that severe, significant, that could literally drive somebody to the point of wanting to end their life. And I think that's something that we're getting better at. Our studies, our treatments, even if is associated with rash, we're obviously trying to clear the skin, but now we're really honing in on itch and really looking at assessments and improving that for the patient. I think, and really putting it on par with the rash in and of itself, especially if somebody suffers from psoriasis or atopic dermatitis or eczema. So I think we've come a long way with our understanding of itch, like you mentioned.
Yeah. And to your point, I mean, that the interesting thing, if you look historically, like if we use eczema as a disorder, right? Like all original studies for, early medicines that were approved to treat eczema just look at skin improvement. They didn't even have itch measures as primary endpoints, like in the clinical trials. And these are all kind of afterthoughts, like, oh yeah, if it makes their skin look better, they're going to be less itchy. And now we've shifted to realizing that the itch is the dominant symptom. That's the thing that people want to fix the fastest and get rid of. And they might have a little more patience to let the skin skin improve, but they really want to feel less itchy. And then beyond that, what you just said in terms of they might have a disorder, but that doesn't mean they're only itchy where those areas are. Studies of both eczema and psoriasis show up to 65% of people can have what they call non-lesional itch, meaning like, you have a plaque or a patch on your skin, but the itch, you itch even on your normal skin that's right next to it or somewhere else on the body. And that's, of course, debilitating.
Oh yeah, and I think, from the standpoint, like you talked about, just giving the attention it deserves now, we're headed there, which is the whole reason we're doing this podcast, because I treat a lot of patients with chronic itch, especially in the elderly population, which often can be affected for multiple different reasons. And one of the things people always come to me, and we'll talk more obviously about different reasons people itch and dive into treatment a little bit more, is, people always love to ask this question. So I'd love to hear your response. My itch is always worse at night. Why is it always worse at night? What's the explanation you give them, regardless of the condition they have, as to why itching seems to be so intense when the body's starting to shut down?
Yeah, so that kind of harkens back to what we were talking about, like kind of nerve fibers and the transmission of itch signals to the brain. The common thought there is essentially that as we're doing things throughout the day, or we're busy, or we're distracted, it's your nervous system is, of course, taking in the world around us, right? Thinking about solutions to problems, what you have to do later, some task you're focusing on at hand, a conversation you're having. But when it's nighttime, or when you're relaxing at home, it's kind of like all those external stimuli are removed, and things are getting calm. Now it's almost like your brain has time to focus on this itch that's just been there smoldering all along, but you've been able to be distracted with other things, and it's like now that's the dominant stimulus, the dominant thing that you're feeling. And so that's why people are often driven crazy by their itch at night, and hence have a lot of trouble sleeping, right? And then it's like this terrible cycle, because the poorer the sleep you have, the more that makes you feel like, whether that's a bad mood or a fatigue, irritable, anxious, etc. And then often that those emotions can make you feel more itchy. And it's this terrible cycle.
No, that's a really great thing you highlight, because I think that is the big thing for patients. We kind of poo-poo itch like it's not a big deal, but the impact it has on their quality of life. And, I'm a mom of 3 kids, 6, 4, and 2. So sleep really impacts my quality of life, and I'm not even itching all night. And you can definitely be a grumpy person that can't focus or be your best self, if you're not getting good sleep. So I think that is a great thing for people to focus on. And how do you treat that itching, get that better quality of sleep, because we can just perform better throughout the day. And I think for those patients too, they'll talk about kind of, not only is that itch worse at night, but, as within society now, anxiety is so prevalent, for various reasons. Some people had a traumatic event, some people suffer from generalized anxiety disorder, but you often see itch and anxiety sort of go hand in hand. So I wanted to get your perspective on, some people say, oh, does anxiety cause itch? Does itch cause anxiety? Are they just a vicious cycle where they're just intertwined? How do you address that with patients, and do you incorporate treatment for that for patients as well?
Yeah, absolutely. So I mean, I think it goes both ways is the really rough part, right? Like folks who are naturally anxious, let's say they have a history of anxiety disorder, are more likely to experience itch, or more likely to be like chronic pickers or itchers of things that may even be, external and happen to everybody, right? Let's say you get a couple of mosquito bites, right? But that kicks off this cycle where, because you're anxious and you want to pick at it, even subconsciously, of course, I'm not saying they're doing it on purpose, they then start picking at other spots that weren't bitten, and they start this cycle where they're like, the more you scratch, the more you itch type of deal. And then, that feeds in further into the anxiety, in fact, right? Because if you're out in public living your life where people can see you, it's embarrassing, of course, societally, right, to itch and to have people think like you have a disorder, or like you contagious, or what's going on. Or if you have itch in embarrassing spots, I've had plenty of patients with genital itch, buttock itch, that sort of groin, and then those are areas that are even more embarrassing, of course, right, to itch.
Mhm.
So I think that makes a patient then feel anxious. Oh, am I going to be out in public, or am I going to be on a date? Am I going to be at a job interview, and I'm not going to be able to resist the urge to scratch? And that makes them more anxious. And along those lines, right, if we go backwards, if you have a skin disorder, right, that makes you so itchy that you're trying to treat, but you're having a really hard time getting it treated, right? Or the treatments aren't working, or for a variety of reasons, right? Now you're feeling anxious. Is this ever going to go away? Am I going to be able to fix this? Am I going to have to adapt to a life like this? What kind of life events is it going to interrupt? So it goes both ways. And to your question about incorporating treatment, that, like, yeah, I feel very strongly about that. I mean, if I feel like a patient is willing to involve, seeing a counselor or something like that because their itch is so bad, I definitely encourage that. But I personally have no problem referring them to, just like a therapist, like non-drug mediated, right? If they just want to do some like behavioral therapy and just some like kind of mind exercises, meditation, or prescribing antidepressant or anti-anxiety medications, because I feel like that can be an adjunct to whatever I'm giving for itch. Or if I feel like the itch is specifically caused by the anxiety, calming that anxiety, then, all of a sudden the itchy spots start to disappear slowly over time.
Do you find patients are open? Because I feel like, there's still such a stigma regarding mental illness, especially in the United States. Are patients often open to that as a suggestion, or do you feel like people shy away from that when you talk more
Yeah,
about?
I think you're right. I mean, I think that not everyone is open to it. It is becoming better. I think it's interesting. Well, it depends whether it's positive or not. I think a lot of society is now on these medications, right?
True, to a
Which
degree, yeah.
perhaps there's overuse, but I think that it's probably more of just that, like, we're starting to become more open, have these dialogues. You're seeing, famous people, wealthy, successful people, being public about their anxiety or their depression, et cetera, and having like us, normal people feel like, oh, it's okay for me to talk to this about this to my doctor, to my friends and family. So I think that there's some recognition there, but still, I think a lot of the patients feel like, well, if you're offering me that, you're telling me the itch is in my head, and that's somehow offensive, right? So I think that the example I'll use is really that nerve conduction, just saying like, your nerves are not firing appropriately. It's nothing that you did. They're sending itch signals to your brain, and you can't stop that. You can't control what your nerves are doing. These medications, although they have historically been used to treat depression or traditional anxiety, can help calm those nerves misfiring and therefore make you feel less itchy. And when you kind of put it that way, most of my patients, it's very uncommon that one declines it. They say, oh, that's very reasonable. That makes sense. I'm willing to try that.
And hopefully after hearing today, people feel more comfortable bringing that up with their dermatologist or their doctor. And I know when they go in for itch, one of the things people want to know is, sometimes you do a clinical evaluation, that's all you might do. But when do you order potentially lab work? Do you find certain labs are valuable? And when do you potentially order it, like I talked about, or do you maybe forego those? And what do you find to be most useful if you're doing a workup for itch?
Yeah, absolutely. So I'd say, the kind of paradigm around that is that if your itch appears to be specifically due to a rash, right, and we keep using eczema and psoriasis just as those are common, then you don't necessarily need to be chasing any labs because those are obvious reasons why you could be itchy. But a ton of our patients do have this chronic itch and not much rash. They might have like spots on their skin because they're scratching, but it's not like a primary rash as we call it, right? So
Mhm.
in that scenario, it depends actually on the amount of time they've had this for. So a year is the typical cutoff because there have been some large studies that have looked at this. So if you've had chronic itch for more than a year, the likelihood of finding something internal that's like really significant and kind of like that Sherlock Holmes moment, like, oh, here it is, and I'm going to fix this, is very unlikely. Okay. So, for you to have some terrible liver disease or kidney disease or terrible infection, HIV, hepatitis, syphilis, or, lymphoma, some type of cancer, like to have that for over a year, it would have somehow manifested in other ways in your life where you would have ended up in the hospital or seeing your primary doc, like something would have been checked, typically. Okay. And then under a year, though, it's one of those things where you could have one of these rare causes of itch, and just it's new in life. And so you don't know why, if a patient is not really connected with a primary care or not really like a doctor going person, they may have no idea. So in this kind of chronic itch that's more acute, if you want to use that term, so less than a year, I often will check, a variety of blood work markers. So, the CBC, a CMP, yeah, I'll check a HIV, hepatitis, syphilis test. And again, a lot of this is kind of potentially more than one would need, right? But I think it's just to kind of, if someone's new to you, or if you're a patient, right, you're listening to this and you're like, I just haven't had blood work checked in 20 years. It's just nice to hit all of these things because you never know what you've been exposed to. Check a chest X-ray looking for potential signs of lymphoma. IgE is a test that can look for kind of higher levels of allergic or autoimmune cells in the body that make you more prone to eczema or hives. I think I've kind of hidden the markers there, but it doesn't have to be every single thing known to man. SPEP is actually another test that is looking for kind of like blood abnormalities, like in the blood cancer, family of disorders, right? And that's something that, your dermatologist may not necessarily know how exactly to interpret that test, but if it were to come back abnormal, we'd recommend seeing a blood doctor. So there are all these things that you can test. And I always tell a patient, even if you've had the itch for 5 years, I'm happy to check these things for you, but I don't want to give them this false hope that it's going to be that one thing I'm going to find. Okay, you have, unknown diabetes and that's what's causing your itch, because, typically it would have been found already.
Mm-hmm. Yeah, good point. And I think you mentioned checking like a CBC or blood count. So again, you're looking for blood type cancers, that might cause itch in that scenario. Is that correct?
Yeah, yeah,
Yeah.
absolutely.
And then you
And then eosinophils, which are like those allergic cells similar to the
Mhm,
IgE that I mentioned, where it doesn't necessarily tell you what's causing it, but it's a
mhm,
marker of like an inflammatory. There's something, a pro-inflammatory in your body that an anti-inflammatory medicines might help with. That's a little
mhm.
bit different from just the nerves misfiring.
Okay. And then you mentioned that CMP for our listeners that kind of looks at liver function, kidney function, some of those electrolytes. So you're really looking at like kidney and liver. Is that your primary like?
Yeah, so kidney and liver is the main thing there, because essentially our kidney and liver kind of would make sense, or kind of filtering toxins if you want to look at it from a high level view in our body, right? So if you're accumulating toxins, that can make your body feel itchy. And we know this from folks who've had like liver transplants or liver failure, right? Or folks whose kidneys aren't functioning appropriately, they're on dialysis or something. These patients are known to get very itchy, even if they don't develop a specific skin disorder. And that's definitely something to look for.
Yeah, important to highlight because I think patients have conditions like that, but shockingly sometimes come in. They might even have known kidney disease or be on dialysis. And I'm really surprised how often that itch is not even discussed with them on the other side. So I think it's important for patients, to understand some of that lab work or that value. You may not even need to do it if you already know, obviously, they have an underlying issue, like you mentioned. And then once you're kind of through the lab work piece, I want to have you touch on treatment here in the last few minutes that we have, kind of talking about one, maybe some things people could do at home, and then sort of briefly covering, maybe, your general approach, which we might have to have you back to obviously in some more detail because I know people are going to love to hear more
Yeah.
about each. But if you can just go over kind of that approach at home remedy versus what you might recommend in the last few minutes that we have here, just to give us kind of a broad overview.
Yeah, absolutely. So to go over like the basics you can do at home, like while you're waiting to see your doctor, your dermatologist, et cetera, is what we call sensitive skincare routine, right? So that basically involves eliminating irritants to the skin. So things like usually fragrances is like the number one thing, or chemicals that are in personal care products. So things that people often will think of like lotions, or, oh, if I put this specific lotion or perfume and it makes me itchy, like that kind of makes sense to a patient. But sometimes we forget things that are kind of more in the environment. So like scented plugins, like those diffusers or misters that sometimes people have in their homes, certain dryer sheets, detergent, although people often do think about detergent, essentially anything that kind of smells like fresh and delicious. It's like our
Good
society,
stuff.
like we like that, the good stuff, right? Like that can be irritating to folks with sensitive skin and
Uh,
can make you more itchy. And then, so those are things obviously you can affect at home. And then even just like kind of personal habits too. So moisturization is super important. And actually, as you age, basically year by year, your skin makes less and less NMF, natural moisturizing factor. And so your body physically gets drier. So because I have some patients that I've never had to use lotion before in my life, and it's kind of strange. You're saying I have to start now, and it's, well, yeah. I mean, our skin gets drier, so using a thick moisturizer, usually like the blander or plainer ones, is ideal. So ones that I mean, there's so many good ones out there, but like thick things like Vaseline, Eucerin, CeraVe, and like a thick cream. Usually we tell patients when you don't want to necessarily say like specific brands, or because there's so many out there, is like something that comes like in a jar is better than a pump, because technically something in a pump would be more like a liquidy lotion. Of course, I tell patients anything's better than nothing. All right. If you're only going to put on the light lotion, put that on. And actually applying it to wet skin. So having you apply that right when you get out of the shower before you dry completely kind of locks that moisture in that's already sitting on your skin. So that's a great idea. And then, essentially not trying to scrub your skin squeaky clean. This is something that was kind of hammered in my itch clinic and in my training. We live in a society now where we want to be like squeaky clean, right? But I think historically humans, didn't have as much itch and as much eczema, supposedly, we obviously don't know from thousands of years ago, but they think it's because we weren't as cleanly as we are now, right? If you look at the dark ages, I mean, I think people were taking a bath like once a year, some people, which I don't
Exactly.
recommend, but, basically our skin was more oily, right? And so now we really want to be as clean as possible. So we take these soaps, some of which are like, very aggressive soaps with a lot of ingredients to take off dirt and oils. And then we're scrubbing our whole bodies and even using a loofah or a washcloth, which removes like skin barrier factors that are blocking that moisture in. And we think we're doing a good job by keeping ourselves clean, right? But you're leading to more itch, more irritation, more eczema. And technically, odor producing glands are in our groin and our armpit and our like face/scalp. So technically, you don't even have to use soap on other parts of your body. I think some patients are really not happy when I say that. Like, what do you mean? You tell me not to put soap on my body? No, of course you can, but basically keep those things in mind. And
Yes.
and that those are all things that can help you at home.
Well, that's great because I hate to say it, but we're out of time. I mean, we have
Yeah,
just really scratched the surface here, as you know. So,
yeah, yeah,
and I don't know why, but we talk about itch and now I'm starting to get itchy. So I don't
yeah.
know. I'll have to ask you that
That
question now,
happens to
why
me
that
too.
happens. Yes, you'll have to tell me the component behind that. Maybe it's more on the mental health side, but you do have to tell me.
Yeah.
It's itching that makes me itch. Well, thank you again for coming on the podcast. I know our listeners are going to want to try to find you to learn more about your work. So where can they locate you social media wise or on the internet?
Yeah, so I'm fairly active on Instagram would probably be the easiest one. So my handle is married underscore to underscore dermatology. So married to dermatology. And I share cases on there. I like to talk about itch, different talks I give and that sort of thing. So definitely follow me, send me questions or comments. I'm happy to engage with anybody who wants to talk about itch.
But I want to thank Dr. Ruiz Dasilva for coming on today to really get us started on this concept of chronic itch and things that we can do. We'll definitely have you back on to talk more about what you can do at the doctor's office, prescription wise. We look forward to having you back to having even a more robust discussion.
Wonderful. Thank you so much for having me. This was awesome. And yeah, I would love to come back and share that because the itch world is kind of blowing up in terms of options to help our patients. And it has me feeling really positive about the future.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to